A recent Rice University study has revealed several Houston locations that are hot spots where auto accidents involving kids happen the most. Joining us live to talk more about this study is Peter Eccles, Director of Policy and Planning for Link Houston. Good morning, Mr. Eccles. First, tell us, what is Link Houston?
Good morning. Link Houston is a nonprofit advocacy group that advocates for a robust and equitable transportation network so that all people in Houston can reach opportunity.
And so tell us what you guys found. Talk about the areas listed in the study that are dangerous for kids.
Sure. So for many years, we've known that Houston in the United States is in the midst of a traffic safety crisis. The United States is one of few developed nations where pedestrian fatalities are actually on the rise. And a Houston Chronicle investigation found in 2019 that Houston has the deadliest roads in the United States by many measures. But what we haven't focused on quite as much is the impact that this is having on kids, on the health and safety of kids who are walking to school. The Baker Institute study that started this conference found over a 6-year period that 159 kids were seriously injured and 21 kids were killed simply walking to school.
So we know that we're talking about specifically pedestrians, kids that are crossing the street on foot. And can you tell me which streets specifically you found were dangerous to kids?
Sure. So the map identified locations across the city, but they identified a few hotspots, the first of which was in the Gulfton neighborhood, Southwest Houston. The next is the Alief neighborhood, and the last is Sunnyside in Southeast Houston.
Okay, so we are showing some video, and we've seen Willcrest Drive and Beechnut. Are those streets that are also hotspots specifically in those areas?
Yes, the hotspots were located at those intersections in particular, and the study took a deep dive at those locations.
Willcrest and Beechnut are the streets where kids were most hurt or hit, and those are in the Gulfton areas, the Alief area. What are some of the other key takeaways that people should know about this research?
So, walking and biking to school for children is obviously perilous, as called out by the study. That's one of the reasons that the share of kids walking and biking to school has gone from about half in 1969 to just about 1 in 10 in 2017. It's a massive drop. But physical activity, walking and biking to school, is critically important for children. It is a way to build physical activity into the routine and to help combat the obesity epidemic. And it also has great impacts on children's mental health as well, giving children a sense of independence as they age. So while we may be keeping our children safe by not allowing them to walk to school in certain instances, it's having dire consequences for public health.
Yeah, I see what you mean. I mean, physical health is obviously very important, but yeah, I mean, the safety to be able to walk to school, it just simply needs to be safer. So what's being done to protect kids in Houston?
Sure. So because of this traffic safety crisis, many of our agencies have already committed to what's called a Vision Zero policy. That states that no loss of life on our roadways is acceptable. Both the city of Houston, Harris County, and even the state of Texas have all committed to a zero fatality goal, either by 2030 or by 2050. And this report, by calling out those hotspots, gives us a sense of where to direct our energies first, focus first on the worst areas where the most kids are getting killed.
All right. Peter Eccles, thank you so much for joining me this morning. We do have this information up now on click2houston.com.